Good afternoon again, everyone. So sorry for the technical glitches that we've had. We will come back to the video that we screened. And once again, we thank all the public servants who contributed to that video. However, let's now move on to our opening and keynote address. We are joined today by a panel of eminent guests. His Excellency, Mr. Tijjani Muhammad-Bande, the 74th President of the United Nations General Assembly, Her Excellency, Ms. Sahle-Work Zewde, President of Ethiopia, Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, His Excellency, Mr. Chen Yang, Minister of Interior and Safety of the Republic of Korea, and Mr. Lu Zenmin, United Nations Undersecretary for Economic and Social Affairs. Welcome all. I'd like to begin by handing the floor to the 74th President of the General Assembly, His Excellency, Mr. Tijjani Muhammad-Bande. Excellency, the floor is yours.
Good morning, everyone. Excellency, Madam President, Honorable Minister, my dear brother, Director of WHO, Excellencies, I would like to thank the UNSG, the head of the UNDESA and his staff for picking this theme, which is not only appropriate to the occasion that we are commemorating today, but also speaks to the most intimidating challenge of our time, the COVID-19 pandemic. I would like to, for the purpose of transparency, also say that I had served as Director General of CAFRAD in Morocco, and therefore had a close relationship with the UNDESA in the past. And it is a very important body in the United Nations system. And I'm very glad the good work of the UNDESA is continuing under your guidance. I would like to say this, that COVID-19 is a pandemic unlike any other known to the contemporary world. At no time in recent memory has the human race been gripped with the fear of a public health catastrophe with such wide ramifications. The rate and speed of person-to-person transmission of this dreaded coronavirus caught many governments unawares and quite a few unprepared. As at mid-June, the number of people infected with the virus had, according to Johns Hopkins University, reached 8.5 million. No less than 457,736 COVID-19 victims come to its fatal grip worldwide. The occasion that we are celebrating today offers a rare opportunity to discuss how to reposition governments and the public service for effective containment of the current and future threats to public safety. Under these conditions, the guidance and leadership of the WHO has been critical. The immediate and common response has been the institution of emergency measures. As long as the public health crisis lasted, governments the world over imposed mandatory lockdowns, enforced movement and travel restrictions, promulgated social distancing regulations, prescribed the use of face masks and hand sanitizers, and regulated social relations in ways hitherto unknown. In a nutshell, the developmental and poverty eradication role of the public service shrank during the state of COVID-19 emergency, while the state's regulatory and policing role expanded. It is true that these necessary measures slowed down the pace of economic activity within and across countries. Decreasing capacity utilization in the public and private realms tragically started a chain reaction whose cumulative damage will take years to undo. Already, the mandatory planned shutdowns and office closures have resulted in temporary separations, outright layoffs, and income losses, According to the latest estimate by the ILO, more than 1 in 6 young people have stopped working since the onset of the COVID-19 pandemic, while those with jobs have seen their working hours shortened by 23%. One unintended consequence, Madam President, Excellencies, distinguished colleagues, of this COVID-19 cloud is the inspiration it has provided for the creative allocation of time, space, and other resources. Thus, to ensure business continuity, many organizations fell back on or discovered teleconferencing, conducting virtual in place of actual in-person meetings, replacing face-to-face decision processes with online communications, and amending rules of procedure to allow for the ratification of draft decisions by explicit or implicit consensus. As the most visible side of government and primary advisor on and executor of policy, the public service also is a duty to itself and to its principles to transform the creative impulses of the COVID-19 period into the performance uplifting and service rendering energy needed to meet the mounting post-pandemic challenges. The retreat of the public health tragedy should, in fact, represent a major turning point in the quest for superior performance in all branches of government, be it in the legislature, judiciary, or the executive and its agencies. In discharging its responsibilities and fulfilling its mandates, the public sector must constantly be guided by the finest principles of public administration, notably altruism, loyalty, dedication, excellence, integrity, responsiveness, and accountability. These same principles and virtues are indispensable to the success of efforts at conquering the post-COVID-19 challenges. Madam President, Excellencies, restarting the economies and getting things moving once again will require extraordinary efforts and a surge of innovative ideas that include substantially reducing the time required to accomplish tasks. It is necessary for the public service to brace for the challenge of post-COVID-19 reconstruction by recording quick wins in at least 3 areas, namely time consciousness, resource allocation, and service delivery. Time consciousness will run setting and enforcing time standards for the delivery of the results in specific areas. Optimal resource allocation or value for money entails keeping an eye on the relationship between inputs and outputs and ensuring that the latter constantly exceed the former. Improved service delivery is, of course, the ultimate objective, the overriding quick win in the post-COVID-19 revitalization plan. This will require, among other things, soliciting the opinions of service beneficiaries on the nature and quantity of service to render, exploring the least costly means of providing the service, fixing deadlines by which the critical operations must be undertaken and the expected services delivered, and paying attention to the qualitative dimension in service delivery. Among the qualitative aspects of service delivery frequently overlooked are timeliness of delivery, courtesy of service delivery agents, and adequacy of information about eligibility and about access. Equally relevant to the service is quality and the extent to which service delivery agents and beneficiaries observe the crucial but steadily receding ethics of public administration, namely integrity, professionalism, impartiality, equality of treatment, due process, inclusiveness, avoidance of conflict of interest situations, and non-corruptibility. Finally, if we learned any lesson from COVID-19, it was that in a period of emergency, the proactive and morale boosting role of the public service remained critical. To contain the spread of fallouts from natural disasters, frontline workers need to be permanently ready with containment and mitigation scenarios. Above all, contact tracing and effective public communication should be the high points of pandemic control efforts. Excellencies, distinguished colleagues, happy UN Public Service Day.
Excellency, thank you very much for your inspiring words, albeit very sobering, as public services all over the globe are dealing with this pandemic. But we must stay true to the principles and the values of public service if we are going to find our way through it. Thank you, Your Excellency. I would now like to introduce a short video statement from the Secretary General of the United Nations, Mr. António Guterres, on the occasion of the UN Public Service Day. Can we play the video, please?
As the world continues to grapple with the deadly COVID-19 pandemic, public servants have been on the front lines of the crisis response. They are the nurses, doctors, and paramedics who provide life-saving care, the sanitation workers who disinfect and clean public spaces, the transportation workers who keep buses and trains running, the teachers who educate our children both on and offline, and the public health officials, data managers, and statisticians who provide vital and reliable information on the transmission and prevention of the disease. Many of these dedicated individuals have carried out their work in dangerous conditions, with high human interaction and without access to personal protective equipment. And some have lost their lives to COVID-19 in the process. Today, as we honor these essential workers and so many more, we must also reflect on how to better protect, recognize, and invest in their well-being as we build back better together. And I say directly to these inspiring public servants, we are all deeply indebted to you for your remarkable acts of service to humankind.
Thank you to the Secretary General for his remarks on the UN Public Service Day and appreciating the changes our public servants face on a daily basis with this pandemic. Much appreciated, sir. Next, we move to our keynote segment, and I would like to invite our first keynote speaker, a lifelong and committed public servant, having had a professional career in the public service, both at the national and the international level. Her Excellency, Ms. Sahle-Work Zewde, President of Ethiopia, to provide her address. Excellency, thank you for joining us. The floor is yours.
Thank you very much, Mr. President, Mr. Director General, Dr. Tedros Adhanom Ghebreyesus, my countryman, Excellencies, ladies and gentlemen. Today we observe the United Nations Public Service Day to highlight the role and contributions of effective, accountable, and transparent public service at national and international levels. I wish to thank the United Nations and the Republic of Korea for organizing this important event. We should begin by defining what we mean by public servant or civil servant. A public servant is someone employed in the public sector by a government or organization. This person embodies a sense of duty and works in a responsible and principled way with a great sense of honor to make a positive impact on the life of others through service. They are expected to abide to the core values of integrity and honesty. Civil servants are the main actors in institution building. They transcend political division, implement the policy of the government of the day, and contribute to ensuring the continuity of states. Public servants are people who have placed national and international values and interests above all. They fight for the common good and are part of building, driving, and innovating the delivery of public services to everyone, and they do all this for modest pay that is circumscribed by the resources at the disposal of the institutions they serve. They are guided by laws and regulations and build institutions to ensure issues of public concern are addressed in a sustainable and scalable manner. They transcend politics and are the foundations of all our governance. We're making this important day, we're marking rather this important day in the midst of an unparalleled global crisis, which has substantially disrupted the work and functions of the public service, but not only. This crisis requires that civil servants adapt to the changing realities of our time and adjust their service delivery to ensure continuity while reducing the impact of the COVID-19 pandemic. And continuity of public services is even more vital today than ever before, now that we are relying on our civil servants to give us reliable information, guidance, and services in these most challenging of times. The overwhelming burden of this pandemic has fallen on the shoulders of the devoted public servers in the health sector. These public servants have been working while putting their lives in danger. Many have been exposed to the virus while continuing to provide essential services, and some have even lost their precious lives. As we mark the UN Public Service Day, we should honor the selfless service and sacrifice of our public servants who have made a real difference in the lives of people in this moment of global crisis. The best way to honor their sacrifice is by devising ways to better protect public servants as they continue to provide essential services under the life-threatening circumstances. In our interconnected 21st century world, technology has made it much easier for individuals to express their views and advocate for what they believe in. This year's Public Service Day is being celebrated in the midst of the COVID-19 pandemic. Civil servants and many other essential workers find themselves on the front lines and not only fighting the pandemic, but also mitigating its multifaceted impacts. They are playing a critical role in protecting the well-being of our societies and providing life-saving assistance to those in need. Civil servants are keeping vital systems integral to our way of life working. This pandemic will undoubtedly come to an end, but it will leave important lessons for us as we work to make the day after COVID-19 better than the one before. The lessons of COVID-19 must lead us to building stronger, resilient, and more effective systems, institutions, and communities. Accordingly, we must invest in public service institutions to ensure their inclusivity, flexibility, and resilience, and invest in public servants. Public servants are our most valuable resource, and we have seen it, and they should be treated as such. This is all the more critical for us in the Global South, where we are working to build the capacity of our civil service and strengthen our public institutions. Thank you, public servant, for your service. I have been a civil servant for all my working life, and I can assure you there is nothing more rewarding. I share your unwavering dedication and commitment to the betterment of all our societies. I call on all of us to renew our efforts and commitment to achieving the objective of building efficient, accountable, and resilient public institutions which serve their citizenry well. I thank you for your kind attention.
Excellency, thank you for such an inspirational address, highlighting the important role played by public servants and that they may not always be valued or appreciated. And that's why it's so important that public service days like this are days which we use to honor and to recognize those devoted public servants. Thank you, Your Excellency. I would now like to invite our next keynote speaker, someone very familiar to us all over the past few months, Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization. Sir, We are indeed honored that you have made the time to join us in what we all know must be a very busy schedule. Please take the floor.
Thank you, Madam Moderator. Thank you so much. Your Excellency, Ms. Sahle-Work Zewde, President of Ethiopia, my President, and very nice to see you virtually and hope to see you in person soon. And President Tijjani Muhammad-Bande, President of the General Assembly, Mr. Liu Zhenmin, Under-Secretary General for Economic and Social Affairs, Your Excellency, Mr. Qin Yang, Excellencies, dear colleagues and friends. First of all, I would like to say Happy United Nations Public Service Day. Since its launch in 2003, this day has marked a celebration of public service. It acknowledges the incredible role and value of public service and applauds public sector workers globally. Although we cannot meet in person this year, I thank our co-hosts, the Republic of Korea, Kamsahamnida, and the United Nations Department of Economic and Social Affairs for facilitating this virtual celebration. As an alumnus of my own country's public service, and now as an international public servant, I have worked alongside countless individuals who have devoted their lives to improving the availability and quality of public services, and my president being one. This year, as the world battles the COVID-19 pandemic, we have all become acutely aware of the capacity and resilience of public servants, especially the millions of essential workers who keep systems and services functioning. In the last few months, we have seen an outpouring of gratitude for the service and sacrifice of health and social care workers. Public service workers are being celebrated in capitals, cities, and towns across the world. It's right to applaud, acknowledge, and celebrate. But I would also like to ask how we're acting upon information, what's that we're doing for others. COVID-19 is not going away. To the contrary, the pandemic is growing. The number of cases and deaths continues to rise. Last month, leaders from all over the world came together to launch the Access to COVID-19 Tools Accelerator, or ACT Accelerator, to hasten the development, production, and equitable distribution of vaccines, diagnostics, and therapeutics. The true measure of success will not only be how fast we can develop safe and effective tools, it will be how equally we can distribute them. It's public service workers in health and social care who are at the front line of this response and are among those most in need of these tools. Excellencies, dear colleagues and friends, it's said that we invest in what we value. The COVID-19 pandemic has refocused our attention on several points. First, the value of resilient health systems that can withstand adversity. Second, the importance of solidarity and equity, protecting others while protecting ourselves. And third, the importance of investing in the health workforce who care for us throughout our lives in every corner of the world. Investing in health workers is not a cost. It's an investment. It's a political and moral commitment to allocate the necessary resources in health workers at the foundation of a safer, more equitable world. Health workers have a right to decent work, as articulated in the UN-approved framework of the International Labour Organization. They have a right to fair and reliable salaries and incentives. And in this moment of COVID-19, they have the unquestionable right to health and safety in their workplace, including the personal protective equipment they need to do their jobs safely. Too many health workers experience mental health challenges from the stress of responding to the pandemic. Too many health workers have contracted COVID-19 while in the service of others. Too many health workers, sadly, have lost their lives. We must also invest in capacity, in the education and training that's necessary to deal with the current emergency and to build the future health workers that's fit for purpose with the competencies to deliver quality care and health for all. We must use innovative methods to build this capacity. WHO is currently working to establish the WHO Academy as a state-of-the-art learning platform to meet these needs. And last month, we launched a WHO Academy mobile phone application for health workers to guide them in the COVID-19 response. Excellencies, dear colleagues and friends, we have a lot of work to do. Enhanced capacity in public service will also create thousands of jobs at a time of historic levels of unemployment. It can also address unpaid social care in homes and communities, which is disproportionately provided by women. At the system-wide level, we need to accelerate additional recruitment, redeploy workers within and across sectors, and activate partnerships for public purpose with the private sector and civil society. We need to ensure that health workers are protected from stigma, harassment, and attacks by providing physical security and safe places to stay between shifts as needed. We must reinforce the facts and evidence about COVID-19 so that the public continue to understand and value the dedicated and selfless public service. Our policy and regulatory environments must enable, support, and protect health workers to deliver safe care. We need to repurpose industry to provide the essential equipment and supplies to keep public servants safe. And we must ask that governments, the private sector, and international financing partners award a high level of priority to health, and within that to the public sector health workforce in particular, without whom there can be no care, no response, no recovery. This is not just about survival, it's about building back better. With stronger health systems, more qualified jobs for workers in health and social care, including for women and young people, and stronger, healthier populations that can resist and bounce back from epidemics. Excellencies, dear colleagues and friends, it's right that we honor public servants today. It's also right that we commit to action. We must protect the rights, roles, and responsibilities of all health workers and public servants if they're to achieve their full potential in managing the pandemic, building back better and advancing public policy and the sustainable development goals. Thank you for your support, your commitment, and your solidarity. I ask that you translate that into concrete action that empowers and enables health workers at the foundation of the healthier, safer, fairer world we all want. I thank you. በጣም ነው የማመሰግነው ፕሬዚደንት። እንግዲህ በእንደዚሁ በቨርቹዋል ስለተገናኘን በጣም አመሰግናለሁ። Thank you so much.
Sir, I thank you for your insightful address and wish you well in your work during these challenging times as you find the tools to manage the pandemic and as you help countries protect their health workers. Oh well, sir. I would like to move now to invite the two co-organizers of today's events to speak. I want to invite His Excellency, Mr. Tijjani, Minister of Interior and Safety of the Republic of Korea, to take the floor. Excellency, the floor is yours.
Good morning, good afternoon, and good evening to you all. as the host of the 2020 UN Public Service Forum supposed to take place on June 23rd to 26th in Busan, it is very meaningful to hold the online panel discussion today. First, I'd like to offer my deepest condolences to the victims of COVID-19 all over. My utmost respect and appreciation to the healthcare professionals around the world who are striving to protect the health and safety of humanity. The Republic of Korea was one of the first countries to experience the threat of the novel coronavirus. At the height of the pandemic, Korea had more than 1,000 new confirmed cases per day and was not able to enjoy physical exchanges with our countries as we used to. At the peak of such crisis, Korea upheld the three principles of openness, transparency, and democracy, and has responded to COVID-19 with 3T strategies of test, trace, and treat, without restricting the movement of people or banning overseas entrance. We have transparently disclosed such epidemiological data to the public, which include the number of confirmed cases and their routes. The Koreans also wear masks as a daily routine and actively participated in social distancing. In addition, massive testing enabled us to find confirmed patients at an early stage and trace their movements. Confirmed patients were then quarantined for proper treatment. With the principles and strategies, it was the dedication of healthcare professionals and high degree of civil awareness and participation that played a pivotal role in pandemic response. Also, public services offered by the central and local government, as well as close civil and public cooperation, laid an important groundwork. From the outset, the Central Disaster and Safety Countermeasure Headquarters has been in place to bolster government-wide, consistent, and swift response. The CDSC headquarters has held daily meetings attended by the Prime Minister, relevant ministers, and heads of local government. The meetings have served as a government-wide regular communication channel to quickly address difficulties on the field and spread best practices. Local governments in particular are the key players. Many creative ideas came from them, including drive-through screening station for quick and safe testing. And dedicated local officials are in charge of management and support for those in self-quarantine, which once amounted to 59,900. ICT-driven public service, such as epidemiologic studies supported by big data analysis, Safety Protection app for the self-quarantine enabled efficient prevention and control of the infectious disease. Yet, COVID-19 is far from over in Korea. We still experience sporadic cluster infections. And if a vaccine or a treatment is not developed in time, a new wave of infection would be something to be expected. The world is in the same situation. International solidarity and cooperation are in order to share quarantine experience, provide resources to vulnerable countries, and develop vaccines and cure. Korea has shared the knowledge and experience accumulated in our response to the COVID-19 pandemic with the international community and plans to provide humanitarian assistance worth $100 million this year. I believe we need more active international discourse and collaboration, not only to overcome the current crisis, but also to explore the new role of public service in the post-COVID-19 era. As the government's role and authority are expected to grow, now is the time to make efforts to realize more efficient and productive public service, as well as promote transparency and democracy. In this regard, today's online forum, under the theme of Pandemic and Public Service Delivery, examining the critical role of public servants at local and national level, carries a great significance. Without the dedication of healthcare professionals, civic awareness, and quality public service all around the world, we would have had a much harder time combating COVID-19. Today, we are joined by distinguished panelists with various expertise, namely the central and local authorities and the healthcare professionals who are leading the responses against the pandemic. I hope today's discussion will serve as an opportunity to examine the role of public service in response to the pandemic and seek future direction of public service in the post-COVID-19 era from diverse perspectives. I sincerely hope that all of us will pull our wisdom and strength together to overcome this crisis and return to normal lives. Thank you very much.
Excellency, thank you, and also for co-organizing today's event as we honor our public servants across the world, and also for providing insights into your country's response to the pandemic. As we look forward to the panel discussion, we hope to hear more in relation to the Korean case around the pandemic response. And to close the first part of today's event, I would like to now hand the floor to Mr. Lu Zinman, United Nations Under-Secretary for Economic and Social Affairs. Mr. Lu, I hand you the floor, sir.
Thank you, Odette. Excellencies, distinguished guests, dear colleagues, ladies and gentlemen. It gives me great pleasure to welcome you to this virtual event on the United Nations Public Service Day. I wish to express my gratitude to the President of the UN General Assembly and Her Excellency, the President of Ethiopia, for joining us today. You are inspiring examples of lifelong and committed public servants yourselves. I wish to thank Secretary General Guterres for his inspiring video message. I also extend a very deep thanks to Dr. Tedros, Director General of WHO, leading the world through one of the most challenging health crises. He has made the time to join us today in recognition of the critical role public service have played throughout the COVID-19 pandemic. I also thank His Excellency Mr. Chen Yong, Minister of Interior and Safety of the Republic of Korea. I'm delighted that despite the disruption to our original plan to host the United Nations Public Service Forum in Busan, Korea, we have continued our strong cooperation to co-host this important event to commemorate the UN Public Service Day. Ladies and gentlemen, this year, more than ever, as we fight the COVID-19 pandemic, we are reminded of the vitality of public service to every respect of our lives. The response to the crisis has seen innovative and adaptive action by institutions at all levels of government and by frontline public servants, such as our healthcare workers, teachers, sanitation workers, transit workers, and many others. At the same time, we have watched the incredible strain the pandemic has put on our healthcare systems and on frontline public servants. The pandemic has provided us with an important moment to reflect on two key issues. First, how to better support public servants in their work, and second, how to build institutional resilience in the public sector so that we can better meet such challenges in the future. Ladies and gentlemen, the importance of inclusiveness and of leaving no one behind has been brought up to the fore during the pandemic. As we battle this crisis, we have seen inequalities, heightened in both developed and developing countries. Inequality in all its forms is a scourge that not only denies equal opportunities for those who experience it, it also deeply hampers achievement of the Sustainable Development Goals. More must be done to address systemic inequality and discrimination. Investment in public service delivery and enhancing social protection, especially for vulnerable populations, is key. Enhanced multilateral cooperation through organizations such as the World Health Organization is essential. The virus knows no boundary in an increasingly interconnected world. Ladies and gentlemen, I would like to conclude my remarks on a hopeful note. Throughout the pandemic, we have witnessed public institutions and public servants respond to the crisis in innovative and adaptive ways. This is something we at the UN DESA witness annually through the UN Public Service Awards. I'm happy to announce today that for the 2020 UN Public Service Awards, we are recognizing initiatives from 7 countries. They are Bangladesh, Botswana, Brazil, Mexico, Republic of Korea, Spain, and Portugal. The initiatives by institutions and public servants in these countries, from using technology to enhance education and social service provision, to providing more robust community-based healthcare for elder populations, have helped advance sustainable development goals. But this is not all. They will better prepare us to respond to crises such as the COVID-19 pandemic in the future. I congratulate all the winning institutions and the public servants who have brought these initiatives to life. I encourage those watching to learn more about them on the UN DESA website. To close, I wish to extend a profound thank you to public servants globally for the work you have done and continue to do in keeping us safe during this challenging time. Now is the time for us to look at how to better support you and your work going forward. I wish you and your families a healthy UN Public Service Day. I thank all colleagues who have supported this virtual event. I thank you for your attention.
Thank you, Mr. Liu, for your remarks, and to you and your team for organizing this very important day. And I'd also like to congratulate all those countries that have been acknowledged by Mr. Liu for the initiatives and the public servants who are behind these initiatives. A hearty congratulations to each one of you. Well, that signals the end of the opening segment of today's event. I therefore wish to thank all the speakers for their time, their insights, and their show of appreciation for the public servants globally. To lead us into the next part of the program, we have an exciting musical treat brought to you by the United Nations Symphony Orchestra. The UN Symphony Orchestra is a community ensemble of the United Nations in New York, composed of musician staff members from the UN, funds, agencies, and programs, as well as missions and family members, representing over 30 countries. So from the safety of their homes, they have recorded a lively orchestral piece, Farandole by George Bizet. The orchestra dedicates this performance to the public servants who continue to selflessly do their jobs during the global pandemic. Let's take a listen.
The Symphony Orchestra of the United Nations Staff Recreation Council is pleased to offer this virtual performance of Bizet's lively farandole from his suite L'Arlésienne. This is our modest contribution to the World Public Service Day, which recognizes the heroic contributions of public servants to humanity. What could be more fitting time for such an event than during a global pandemic? Or a more fitting venue than the United Nations, whose very foundation is public service? While our diverse orchestra cannot hold hands and dance the true farandole in the tradition of Provence, we are united in honoring those who sacrifice for others. Their reward and ours is to more truly appreciate the true joys of life. As Nelson Mandela said, there can be no greater gift than that of giving one's time and energy to help others without expecting anything in return. Come now, let the dance begin.
Wow, just amazing. Thank you to all the members of the UN Orchestra for that lively piece. What a fitting tribute to the life-saving work public servants have been doing during this challenging time. Truly inspiring. And it's always a very proud moment when I hear the former South African president, Mr. Nelson Mandela, being mentioned. A great example of public servants across the globe. Now that we have a bit of bounce in our step, let's continue the momentum with a lively panel discussion. I have with me today a panel of distinguished experts to discuss the role of public servants and the public service in the COVID-19 response. These panelists have been working from various perspectives at local, national, and global levels throughout the pandemic. I'm delighted to be joined by Dr. Injay Lee, Assistant Minister for Planning and Coordination at the Ministry of the Interior and Safety in the Republic of Korea, Ms. K.K. Shailacha Teacher, Minister of Health and Social Justice of Kerala State in India, Ms. Annette Kennedy, President of the International Council of Nurses, Mr. Jim Campbell, Director of the Health Workforce Department of the World Health Organization, and Ms. Rosa Pavanelli, General Secretary of Public Services International. I'm going to begin by posing a question to our first panelist, Dr. Injay Lee, who is the Assistant Minister for Planning and Coordination. Over the past decade, Dr. Lee has held numerous positions in the Ministry of Interior, including working on decentralization, e-government, local administration, and regional development. Dr. Lee, the Republic of Korea has been referenced globally as an example of good practice in early intervention in stopping the spread of the coronavirus through the use of cutting-edge technology, the rapid rollout of testing, and the provision of free health services. Can you discuss how such a rapid response was possible and what role technology played in detecting and tracing cases?
Thank you, moderator. Korea experienced the COVID-19 outbreak earlier than other countries. However, we have swiftly responded to the situation thanks to administrative systems and close cooperation among governments, agencies, and businesses. First of all, the Korean government has been prepared to quickly deal with similar situations with the infectious disease response system in place after SARS and MERS outbreaks in 2003 and 2015. The Central Disease Control Headquarters coordinates infection prevention and control efforts as the command center. And the Central Disaster and Safety Countermeasure Headquarters provides all the other government-wide support. Similarly, approval procedure for test kits was streamlined. This enabled rapid response to COVID-19 with over 20,000 daily tests early on. The government was able to track down confirmed cases through over 1 million tests, which is a remarkable figure considering Korea's 50 million population. Close cooperation between the central and local governments and between the public and private sectors was instrumental as well. Drive-through screening, first suggested by a doctor, was adopted by a local government and then spread nationwide. Active cooperation between the government and credit card companies also deserves to be mentioned. By using cellular GPS data and credit card transaction logs, competent authorities tracked down visitors to the regions where mass infection occurred. Above all, it was a high level of civic awareness that was key to curbing the spread of the virus. The public has voluntarily practiced personal hygiene, such as wearing masks and social distancing. This helped minimize further spread without any lockdown measures. In April, for example, Korea became the first country to hold a general election during the peak of the pandemic. Voters cooperated with the National Code of Conduct for voting, such as wearing disposable gloves and keeping a 1 meter distance from others. Confirmed patients also voted either at hospitals or at the polling stations specially built at the living treatment centers they were staying. With all the efforts and collaboration, not a single case related to the election was reported so far, despite 29 million voters. Moreover, cutting-edge ICTs played a vital role in fighting COVID-19. For example, the government released real-time data on the stock of government rationed masks. By using the data, the private developers launched mask inventory tracking apps. These apps have helped the public easily find the pharmacies with masks in stock and buy them with no difficulties. In addition, as all inbound travelers have been required to quarantine since April the 1st, the government launched the self-quarantine safety protection app for effective monitoring of the self-quarantine. While fighting against COVID-19, we have learned several lessons for a better response to future crises. Above all, we realized the current infectious disease response system needs to be further strengthened. To this end, the government decided to upgrade the KCDC, currently within the Ministry of Health and Welfare, to an independent administration. This will allow more effective response in future crises through swift and independent decision makings. In addition, regional disease response centers needs to be established to improve infection response capacity with more efficient use of locally scattered medical resources by region. Last but not least, another key behind the successful response to COVID-19 is the well-established digital service infrastructure enabling remote education, working, and conferences. As the culture of non-face-to-face service is expected to rise as a new standard, we felt the need for swift policy transition. To this end, we have launched the Digital New Deal policy, which emphasizes national 5G networks, non-face-to-face public services, and cloud migration of information systems. Thank you.
Thank you, Dr. Lee. We will return to you a little later if we have time. I'd like to now turn to Ms. K.K. Sahle-Work, teacher, Minister of Health and Social Justice of Kerala State in India, who has been described in the media as the coronavirus slayer due to early intervention in identifying COVID-19 and putting in place measures to stop transmission. Prior to her life in politics, Ms. Sahle-Work, teacher, was a science teacher, earning her the last name she uses today, teacher. Mrs. Sahle-Work, Kerala State has one of the lowest COVID-19 related mortality rates in India, largely due to the adoption of early measures such as testing, tracing, lockdown, and public health provision. You said that this early intervention came about in part because of the state's experience with handling another deadly virus, Nipah, in 2018. Can you tell us a little about how the crisis helped Kerala better prepare for COVID-19 and what public service systems you had in place as a result?
Madam Moderator, Your Excellencies, in this context, what comes to my mind is that, as you all know, earlier in 2008, United Nations came up with a strategic framework on the concept of one world, one health. I think it is most relevant in this present global context. Our government, led by Honorable Chief Minister Sri Pinarayi Vijayan, realized it better during the Nipah outbreak in the state. This zoonotic disease outbreak of pandemic potential helped us to understand our strengths and weakness, and also the need to bring the effective integration of human, animal, and environmental health. Not only this Nipah epidemic, but our health system resilience was put to test recently in the two major floods. When the catastrophic flood devastated many parts of the state in 2018, many epidemiologists projected that this flood would be followed by a flood of infectious diseases. However, thanks to the sensitivity of our public health surveillance and the aggressive public health measures, we were able to effectively prevent any such epidemic. All these episodes taught us something very significant, that when it comes to public health interventions during an outbreak, there should not be any compromise on delay to act. Coming to COVID, the very next day of WHO statement of caution on a respiratory virus of pandemic potential, we activated our entire surveillance network. Guidelines and standard operating practices for screening, diagnosis, and public health interventions were we put in place in line with the international guidelines while leveraging on our core strengths and decentralized public health delivery systems. Thanks to our surveillance system, we were able to report the first 3 imported cases of COVID-19 in the nation. We effectively identified, isolated, and treated them so that all the cases in that phase, which we call as phase 1, recovered fully with 0 spread and 0 mortality. Our case fatality rate is equal to 0 and basic reproduction number also 0, a dream for all public health enthusiasts. However, we know that the game has just begun. So we continued our surveillance, strictly complying to the international and national guidance. From the very beginning, our objective was straight and clear, that is to minimize the spread and minimize the mortality. So considering the international available knowledge, we set up a target to limit our case fatality rate below 2 and basic reproduction number R0 below 1. This is to ensure that we don't have a local epidemic, so that we can utilize our health system capacity primarily to deal with the imported cases. Our strategy for public health interventions was mainly targeted in 4 angles. First is regarding the potential source of infection. To address this angle, we adopted a strategy of trace, quarantine, test, isolate, and treat. Our primary focus here is on early and strong public health intervention, including aggressive tracing of potential cases and their contacts, strict quarantining, focused and strategic testing, strict hospital isolation, and best available treatment. The second major targeted strategy is to decrease the amount of circulating virus in the society. For this, we started a massive people's campaign called Break the Chain campaign. The revolutionary campaign, which every media, organization, and almost every person owned up, focuses on the acronym of SMS, so mass social distancing. Third strategy is to stop the virus from reaching the vulnerable population, including elderly, people with chronic comorbidity, and pregnant women and children below 10 years. This is largely achieved through reverse quarantine. By these 3 major strategies, we are trying to aggressively hunt down the virus, thus minimizing the local spread and mortality. Success of this approach is evident from the fact that even after 142 days of epidemic and over 650,000 people kept under surveillance till now, and after tracking down the treating thousands of imported cases, we have been able to keep our local spread below 12.5%, with R0 below 0.25, and our case fatality rate around 0.6%. while maintaining the test positivity rate below 2. However, while doing this, we did ensure that the people who are already marginalized and vulnerable are not disproportionately affected by the containment measures. In this perspective, we strengthened our decentralized social safety network for the vulnerable and marginalized people and also for animals so as to live up to our containment to the concept of One Health. Thank you.
Thank you, Minister. I'd like to now move to Ms. Annette Kennedy, President of the International Council of Nurses, a federation of more than 130 national associations representing more than 20 million nurses worldwide. Annette was also commissioner on the WHO Independent High-Level Commission on Non-Communicable Diseases and Director of Professional Development for the Irish Nurses and Midwives Organization for 19 years. She is a registered nurse and a midwife. Ms. Kennedy, this year is the International Year of the Nurse and Midwife. So it is fitting that nurses have been in the spotlight like never before. Nurses comprise the majority of the health workforce worldwide, and many nurses working through the pandemic have been exposed daily to the virus as they work lengthy hours in high-risk situations without adequate personal protective gear. From your work with nurses associations around the world, what needs to be done to better support and recognize nurses in their work? And what measures must be undertaken to build the capacity of nursing and health work professions?
Thank you, Odette. Thank you, Madam Chair. Your Excellencies, it's a great pleasure for me to speak on this United Nations Public Services Day. As you said, I represent nurses, and since the very beginning of the COVID-19, we have been hearing from our associations all around the world. We, at the beginning of the year, we had planned to celebrate the Year of the Nurse and the Midwife. We had planned in every locality and every country and every area throughout the world to celebrate and showcase nursing. But of course, COVID-19 changed all that. And with it came what we now see, that nurses are essential to the service, essential to the health service, to the backbone of the health service. They've always been the backbone of the health service, but it has never been recognized until now. And of course, we started hearing about the issues that are facing the frontline health workers, and particularly nurses, as they make up 60% of the health workforce. And they are with the patients probably 12 hours, 14 hours a day. So they're most at risk. And the issues that were facing them was the lack of protective equipment. And we started calling on governments, even from that early stages in end of January, for protective equipment to protect our healthcare workers and particularly our nurses. But even as late as last Friday, we've been hearing from our colleagues in Latin America and in Africa that they still haven't sufficient protective equipment. And in fact, they haven't got masks and they haven't got gloves. And the protective equipment they have aren't suitable, they're inadequate, they're too small. So it's like giving people, protective equipment that doesn't fit. You might as well have nothing. It's not going to protect you. The second issue that we're really concerned about is the fact that they don't have access to testing. Frontline staff, particularly nurses, should have access to regular testing, because what we are hearing is that a lot of nurses are becoming infected with COVID-19 and are actually dying, and some have committed suicide. So we have been asking for governments for surveillance to trace and to investigate infections of all healthcare workers, but to identify by grade and by profession, and to have standardized collections and reporting to WHO so that we can identify where this is happening, how it's happening, why it's happening, and that we can further prevent infection. This is the least that can be done to protect our healthcare workers and particularly our nurses. There is a duty of care to these people. And the third thing that is really upsetting us is the violence that's been perpetrated against nurses. Abuse, chlorine being thrown at them, spitting. And recently in Mexico, extortion, where we had nurses being kidnapped and their relatives being forced to pay money in order to get them back safely. This is unacceptable, and governments must call and see that these perpetrators are brought to justice. We cannot have this for people who are putting their lives at risk. And we also see that nurses have been doing a lot in relation to organising and making sure that the services are right for, not just for COVID-19, but for other people who need the service, need health service. But they're not involved in policy. They're not involved in strategic planning. And this is unacceptable because they know more about patients than anybody else. But to go back to what can be done, and the State of the World's Nursing Report brought out by WHO in April indicated a number of areas that can improve things. So there's a roadmap to improve the service, and it means investing in the service. Because we have seen from COVID-19, the first thing that happened was that nurses were being called back into the service, retired nurses, nurses that hadn't finished their program from the university, nurses that were doing part-time work were being called back. So it's obvious that we were short nurses. We know that we're short 6 million nurses, but we're even short right now. So we need to invest and we need to protect them. So we need to build nursing capacity. We need to allow nurses to work to their full potential because they're doing nurse-led services, they're doing advanced practice, and we need the legislation and we need the regulation to allow them to practice. We need them to be involved in leadership and policy because they know more about the people that they look after from birth to death and from community to hospital and from families. And we also need, if we want to retain the nurses in the service, we need to make sure they have better conditions of employment and better pay. Otherwise, we are not going to retain them in the service and we won't have a service, that's for sure. But just to, I suppose, represent the nurses themselves. I had a letter from a nurse on the front line, and I'm going to read an excerpt from her letter, which more portrays what nurses are going through now and going through on a regular basis than I could ever say. So with your permission, I'll read it. Our lives now, engaged in hospital in COVID-19, are like a continuous roller coaster ride. Fatigue and anger, then sedated by the first successes on patients that you can finally transfer from the intensive care unit, and with who, despite the short time and those dressed that barely allow us to breathe, find time to talk and communicate with them, to make them feel they are not alone. We're the only company they have, and it is impossible to smile with a mask, but we learn to talk and smile with our eyes. The system is not protecting us, and we have to fight for COVID testing and for proper PPE. Nurses even look for donations or for families to help them. If all the nurses stopped now, there would be the greatest human disaster of recent times. The reality is that everyone knows this fact, and we as nurses know it too. And it is perhaps one of the only real reasons why we continue to struggle with dedication and professionalism in this emergency, even at the cost of our own lives. At this emergency, we have already arrived exhausted, with a salary blocked for about 20 years, with staffing levels reduced to the bone, in a social landscape strongly changed due to chronicity. But nurses have always remained, despite the increase in duties and continued disappearance of our rights, ensuring that citizens maintain their health. And the signs on our faces are the only evident part of the scars we have inside, for being worried, for being not enough, or being too tired to give the best assistance to our patients, or to come back home and infect our families. Our attitude is to think and take care of people, and we are doing this to the best of our ability.
Thank you, Annette. Indeed, heartbreaking, and I think you've raised some really concerning issues around the protection and safety of our nurses. And that's why I want to stay on this theme as we move to Mr. Jim Campbell, the Director of the Health Workforce Department in the World Health Organization, which supports countries in achieving national and international goals to strengthen their health workforce. The department's work includes the State of the World's Nursing Report, the WHO Global Strategy on Human Resources for Health. Mr. Campbell, healthcare systems can only function with a strong, agile, and motivated workforce. Yet according to the WHO, before the pandemic, the world was short of 18 million health workers to meet the globally agreed health targets of the Sustainable Development Goals by 2030. The COVID-19 pandemic has sent shockwaves to health systems globally, with the phrase flattening the curve now in common vernacular everywhere. An attempt to ease the burden on an already strained health facilities, and in doing so, help save lives. Mr. Campbell, what needs to be done to manage the pandemic and enhance capacity so that we can better tackle such crises in the future and to stay on track to meet the SDGs?
Madam Chair, good morning, good afternoon, good evening. Thank you very much, and my congratulations to the co-hosts, and thank you very much for the opportunity to speak today from Geneva. The two parts of your question there. Let me deal with the first one on the pandemic. And the honourable ministers from the Republican Korea, from Kerala state in India, have given us two excellent examples of how to manage the pandemic. And there's a number of factors which we're seeing across jurisdictions, which are indeed very common themes that are emerging in terms of having success in indeed, as you say, flattening the curve, this new language that we're all now familiar with. Firstly, I think there's an element of personal engagement in terms of the communities and the people, the population, to ensure that we invest in personal hygiene, in hand washing, and in following the guidance that's provided to us from the experts in government, from the public service, or from the evidence that the World Health Organization, the likes of the International Council of Nurses, are making available. So to make sure that we're following social distance. We're then seeing that governments and their leaders are very much driving the test, trace, and treat mandate of the response. Know what you are dealing with, know the incidents in your population, and ensure that you are being as responsive as possible. And we've seen innovation as the minister, the honourable minister from Republic of Korea put forward there. How do you scale up your testing? How do you introduce drive-through testing? How do you use technologies to make that possible? The other element we're then seeing in terms of managing the pandemic is the global solidarity that the Director General, Dr. Tedros, spoke about in his keynote remarks. And this is the element of accelerating access to the COVID tools globally. And we're seeing that this is having a major impact in our approach. So we can accelerate both the potential of the vaccine, the diagnostics, the therapeutics, and to share that globally on an equitable basis. The other element, I think, that the president from Annette Kennedy mentioned in her remarks, the emphasis on personal protective equipment, infection prevention control that we heard from the country examples, to really address this at scale and to do it well, to ensure our public service workers, our health workers in the front lines, be they nurses, be they midwives, be they other clinicians, emergency workers, are enabled and protected to go about their works. We should all be saddened, but also shocked at the number of health worker infections around the world and the tragic loss of life. Let me turn then to the second part of your, how do we build back better, this phrase that we're now starting to hear. And again, I point to the Honourable Minister from Republic of Korea, who talked about how they are already introducing new public sector engagement, reducing contact interaction and using technology and tools there to take that forward. How can we build back better? You rightly talk about the shortage of 18 million healthcare workers that we've seen globally around the world. When we talk about the education sector, for them to achieve their ambitions in the Sustainable Development Goals, you're looking in the magnitude of maybe a shortage of 70 million teachers worldwide. And why are we short of our core public sector workers that we now realize are absolutely essential to such situations when we have a global pandemic, when children around the world, 90% of the students around the world, are no longer in school and are reliant upon new innovation. It is the impact of not investing in education and employment. And we need to take that action if we are to achieve our public policy goals. We have the representative, the Under-Secretary General from the UNDESA with us today. And he has been with China and the SDG Fund, one of the first organizations to work with WHO to actually address this shortage in investing in education and employment in the health sector. We are working in a number of countries with UNDESA and China's support to address this phenomenon. We need to invest in human capital and social spending in the health, education, and social protection sectors. ICN, the International Council of Nurses, and your final speaker from Public Services International were part of a UN high-level commission on health sector employment and economic growth. The evidence is absolutely clear, crystal clear, on the investments we need to be making. We need to connect in the skills and the competencies of the future workforce. We need to ensure people are provided decent work. We need to aspire to equitable distribution of that workforce to respond to population needs. Sometimes a pandemic will teach us many things. Sometimes an epidemic and a global response to it will give us new lessons. But at this moment in time, we should also look to the existing evidence and the existing lessons to actually say part of this response is for the political will, the political leadership to invest in a public service and a public sector that is fit for the ambitions of the Sustainable Development Goals and for health, for the ambition of universal health coverage. Madam Chair, thank you very much, and a happy UN Public Service Day to all listeners and speakers.
Thank you, Mr. Campbell. Indeed, the statistics on shortages, we definitely have to make huge investments in relation to our human capital. I would like to now turn to Ms. Rosa Pavanelli, who is the president of the Global Union Federation, Services International. Ms. Pavanelli has also served as commissioner on the UN Secretary General's High-Level Commission on Health, Employment and Economic Growth, representing the trade union movement, health workers, and public services, amongst other high-level positions. Ms. Pavanelli, I'd like to broaden the focus a little and talk about the work of public servants beyond the healthcare sector. Measures adopted to contain COVID-19 all around the world have had a massive impact on labor relations, as we know, and on labor conditions for millions of workers in many essential public service areas, be it sanitation, transit, postal, education, utility provision, and many more. You work with PSI. Can you talk a little about what impact COVID has had and discuss the role labor unions have been playing in safeguarding labor rights? How do you think the pandemic will impact public service labor conditions and relations going forward?
Thank you very much, Madam Chair, and thank you all for inviting PSI to the celebration of this very peculiar World Public Service Day. I would like to say that as PSI, we organize public service workers in different sectors, but 60% of our membership is in the health sector. And I cannot do other than share and support what Annette Kennedy and Jean Campbell just said about the importance and the role of health workers and the need to invest in public health systems. You ask me how, I think that this pandemic has unveiled a situation, a truth that we all knew was there, but was untold. And the fact is that there are workers that are often hidden, but are essential to keep our community working. Workers providing clean water, sanitation, transport, janitors, teachers, all those workers who are often, or in the past, have often been scapegoated as the responsible of public spending, of the increase of public debt. And then in a sudden, we realize how fundamental they are, not only to keep our community safe, but also to keep our community alive and economically viable. The role of public services is not just providing services that are useless for the economy. And we have been able to show that making the economy working in many places, helping the private sector to continue perform, and supporting also the families and the communities in many places. It has changed the labor condition, of course. My colleagues from the Nurses, International College of Nurses just told us the difficult working conditions that are out of any international labor standards that many of the nurses, and I would say health professionals, as well as water, sanitation, public utility workers had to face with long working hours without personal protection equipment. But I would say that this was an effort that our members knew they had to face to support the community. And this is the big sense of the mission that public services and public service workers are required to perform. But having said that, I don't like that we call public service heroes. They are workers and they deserve dignity. They deserve decent wages and decent working conditions. They deserve respect and they deserve the recognition of the role they play for our communities at large. And this is why the role that we played as Public Services International was, since the very beginning of the pandemic, to get involved with our affiliates in order to support them with all the available information, the training and the advocacy towards the health authorities, the public authorities, the local government, everywhere and around the world, as well as engaging ourselves, as we normally do, with the WHO, with the ILO, in order to continue highlighting the need of high standard to protect public service workers. Just to conclude, I think that it was not something unforeseeable what happened and what is still happening in many parts of the world because of COVID-19. We had the experience with SARS, we had the experience with Ebola, and we knew that something like that could happen. Yes. What is shocking now is that this is a pandemic, it's affecting all the world, and mostly it's affecting also the developed world. So having to deal with this issue means that we need to readdress the idea of development that we have, both in developing and in the developed world, and make efforts to invest in public services means working for socially, environmentally, and economically sustainable development for all.
Thank you very much, Rosa. Time is definitely not on our side, and there's so much the panelists have said, which I would like to follow up on. However, I will give each panelist an opportunity in using 1 minute, not more than 1 minute, panelists, to very quickly respond to what do you believe is a priority action for countries to be better prepared and to protect their public servants, given that today is Public Service Day. What would be that one thing, one bit of advice you would give to countries? And let's go in order of the panel. And I'll start with Dr. Lee, and then we'll move to Ms. Sahle-Work, and then to Annette, and then to Jim, and then to Rosa. Okay.
Yeah, in the process to fight the COVID, we need to protect personal data. So I would like to, ask the international community to join Korea's efforts to protect personal data overall, because all the people all around the world intertwined with close networks have the rights to be forgotten in privacy issues. We are in the front line. I mean, Korea is the front line to protect personal data all the way to fight for COVID-19. That's it. Thank you.
Thank you, Ms. Sahle-Work. Okay, I don't see Ms. Sahle-Work on the call. Can we then move to Ms. Kennedy?
Okay. I think if I take...
Okay.
Sorry, Annette, let's let Ms. Sahle-Work go first. Thank you, Minister.
Madam, I am answering for your second question, Can you hear me?
Yes, we can hear you, ma'am.
Okay. And as you may be aware, Kerala state went on to lockdown even before the declaration of the nationwide lockdown. However, it was not done as a sudden knee-jerk reaction, but it was organic evolution, ensuring people's participation and trust. This was followed by a series of daily press conference by the Honorable Chief Minister and expressing the daily scenario of COVID-19 in the state. All the measures which needs to be taken to contain the epidemic, implications of these measures on people's lives, and especially of most vulnerable sections in the society, and proactive actions taken to minimize the negative impact of these actions. One of the slogans taken up was that no one would remain hungry during this lockdown period for any reason. To ensure that Civil Supplies Department, local self-government, Women and Child Department, and even Education Department converge the strengths and resources. All who required food supplies were provided it almost at their doorsteps, irrespective of their socio-economic status. Over 1,325 community kitchens were established across the state, and over 86 lakh people were served cooked meal. In addition to this ensure child nutrition, the steps were also taken. Over 3,700 destitutes were rehabilitated to safe accommodation to make sure that they remain safe and attended. In addition to the lakhs of government officials, a team of social volunteer force was also created across the state with over 3,40,000 field-level volunteers to augment the relief and social support systems. Special relief package was announced and such activities were conducted and committees were established even at the grassroots level to tackle the problem. The information penetration system is also very good. And however, as you know, social media is the most important part, and we know it is double-edged sword. So we established a system to monitor social media to prevent the misinformation, and daily press conference through the conference we ensured that. And so deliberate and proactive actions were taken to ensure that any decision during the period is full in line with the democratic ethos of this state. In a historical perspective, one thing which helped us to bridge the information asymmetry among the people is that we have relatively equitable society in terms of resources and opportunities when compared to other states of India. The reasons for this are many, including the land reforms in the late 50s, centuries of social reforms and educational reforms, etc., that helped us very much. This was further returned, nurtured, and sharpened by the special initiatives called a mission called Ardhra. We just started in the health sector to have more investment in the health sector, and our slogan was to make the public health system as patient-friendly and also highly technological, and we are doing that, and that also helped us in this period to tackle the problem.
Thank you, Minister. Thank you very much for that.
I want to congratulate and convey my thanks, our nation's thanks to South Korea, Republic of South Korea, for the effective intervention, and thanks for the United Nations. Long live the unity of the public reference.
Thank you, Annette. Sorry, that means you got half a minute to hand out what you think is the priority.
I think I can do that. I think we need investment. We need improved healthcare systems. We need to be better prepared. We need to learn from other countries what to do. I think what we did wrong was that many countries went into treatment and emptying beds and looking at ventilators rather than preventing treatment. So I think that surveillance is essential, and so that we don't forget all of those other conditions out there, like vaccination, like people who need to be screened, people who need to be treated, because there's at least 2 million children who haven't received vaccination from measles in Africa. So that's my half a minute.
Thank you. Short and sweet. Thank you very much. Mr. Campbell, if you're still on, is Mr. Campbell still with us?
Yes, still here, Madam Chair. And so thank you very much. To better protect public service workers, what do governments do to prepare for that? The evidence. I think we need to reinforce our evidence knowledge and the way that we act upon that. We've seen disinformation, we've seen false information, we've seen misinformation deliberately to try and confuse part of the response to the epidemic within countries and the pandemic globally. We need to drive that further forward. We need to, I agree entirely, we need to protect our public service workers. Their data is part of that, but also their occupational health and safety. it is an absolute right to expect decent work conditions, and we need to ensure infection prevention control measures, personal protective equipment are there. And thirdly, we need to invest in the public sector and our public sector workers in their education, employment, and in giving them dignity and respect. Thank you.
Thank you. Rosa, you've got 1 minute. Thank you.
I need to say that to ensure what Jean Campbell just came to say, dignity, occupational health and safety, and decent working condition for public services, we need resources. Resources that we have to find in reforming the global tax system and taxing corporates, and stopping tax evasion and tax avoidance. There's the money that our community needs. To say that we need a build alliance with local government, with a national government and authorities to enhance the role of public services. And we, above all, we need the global will to change a system that showed to fail, and support, in this sense, the effort of the WHO to achieve a vaccination that will be available for all and not for profit.
Thank you. Well, folks, we are just about out of time. I'd like to thank all my panelists for joining me today and you at home for watching. As we continue to battle this pandemic, let's remember that we have heard here today, we must do more to enhance our support to public servants as they carry out their very vital work. Waiting for a crisis point is not an option. We must invest early and robustly to be better prepared. On that note, I'd like to end today's event by playing the UNDESA public servant dedication video once again to remind us all of the diverse and dedicated service our public servants provide. I wish you all a healthy and safe United Nations Public Service Day. Thank you and goodbye.
코로나19는 우리의 단합과 희망을 꺾을 수는 없습니다.